I'm Dave Spurgeon from NACRO, working with agencies in Staffordshire to review and revise the Mental Health Crisis Care Concordat. We're here at Keele today to both launch and promote the revised Concordat, to celebrate the success that has been achieved in Staffordshire since the original Concordat was signed in 2014, to highlight some of the issues that still need to be developed, and to work together to develop an action plan and key priorities to meet the needs of people in crisis. So today we have a number of presentations highlighting the key aspects of the Concordat Declaration around partnership working, around providing services for those people in crisis, hearing the voice of people with lived experience, and then sitting together in 3 workshops looking at the needs of people in further and higher education, in community provision, community settings, and within the criminal justice system, and to develop the work plans accordingly. The outcome from today will be to kickstart and develop further services that meet the needs of those people within crisis, to agree an action plan, to ensure that the voice of lived experience is heard, and to make sure that we work together to achieve the aims and make the Concordat Declaration a success.
I think it's really important from a National Probation Service perspective, because a number of the people who we work with daily experience problems with their mental health, and that impacts really significantly on their ability to engage with us and make progress. So the Concordat is really important so that we have a whole system working together to intervene as early as possible with the individuals that we all work with.
Really, because mental health crisis, it's not isolated to the NHS, it's not isolated to the police, it's not isolated to any one service. So to make sure that we are responding to people in crisis and doing everything we can to prevent a crisis, it's vital that we actually work together as agencies and make sure that we have responsive and consistent services.
I think it's the chance and the ability to bring everybody together in the same room with a same set of aims, and actually gives us the chance to work together. I think when you look at areas where they haven't got a very proactive crisis care concordat, you see that actually services still are working quite alone. People haven't got an idea around crisis care. So for me, it's a real big thing, and it's really exciting it's being relaunched.
Because it orders the way that we will deal across services with people in mental health distress, in crisis. Too many people back in 2013 were finding themselves locked up in police cells because they were unwell. In a society like ours, a modern society, that is outrageous. So the Concordat sets out very clearly what different agencies need to aim to do. It puts some order, which is most welcome, across multiple agencies who play a critical part in this. And hopefully the result will be earlier intervention, the ability to stop people from falling further and further into crisis, possibly into the criminal justice system, which is my area, and we'll get better, more appropriate support and help when they need it.
It's really important for us that students and education is included in the Concordat. I think it's fantastic the work that's already been done in the Concordat previously that's really focusing on crisis intervention, and now we're looking at prevention, early intervention, which is where universities really come in, and that is so important for us, with the ability to keep students well and know where they need to go if they are really struggling and we do get to crisis point.
Being part of the original Concordat, from a Staffordshire Police perspective, we were able to see what difference the declaration made with partnerships, how it allowed partners to come together with key objectives, common themes, areas of working, and also to put some challenges in place about future working that we need to. So we've benefited quite a lot from the original Concordat, hence why we were quite supportive of the refresh of this Concordat, because we felt it was time to bring it up to speed in relation to what was going on within our communities at this time and start to have more of a future focus.
I think the voluntary sector have a different perspective and they have something else to offer. So we're not clinicians, but we can work really well with statutory, and we also have the ability to move and mobilise a little bit quicker than some of the statutory organisations. So we're more likely to think outside the box, how we can bring something in, look at what the problems are, and then go, actually, we've got a solution for this. This is what it is.
I think we need to be true to the sentiments of the Concordat, that we have the Concordat signed at the very highest levels of organisations, and we need to make sure from the top down that we're actually responding to people in crisis according to our pledges within the Crisis Care Concordat.
I feel that obviously from a strategic perspective we've got a lot of organisational buy-in and commitment to say that this is something across Staffordshire that multi-agencies want to contribute to. What we have to do now is to translate that into the operational side of building and strengthening our existing mental health pathways.